All right, we're back with Marie Williams, everybody, and she wanted to pick up right where we left off as we were talking about these best practices and other things. Go ahead, Marie.
Well, I'll start with the one that we began a few years back called the Creating Homes Initiative. That has been seen as a best practice nationally. We've gotten all kinds of awards with that. And Rhori, what that really was when I started in 2000, it was this concept that you can take a small amount of money, you can teach providers across the state how to apply for other grant dollars, and you can grow that money. And by growing that money, you can expand housing supportive options for Tennesseans that need those. When we started, we got about a $2.5 million investment from the General Assembly. If you look at how much we have leveraged, it's almost $600 million across the state in different various forms. And we've created well over 6,000, 7,000 housing options. That's a best practice.
No, wait a minute. Give me those numbers again, because that's pretty remarkable. You started with how much?
We started with 2.5 million and have been able to leverage over 600 million. And we have been able to create over 6,000 to 7,000 options. Now that's on our website. I don't have it up in front of me. But what I've loved about that is every administration that's come in has kept this program. But not only have they kept it, because I mean, it's an incredible return on investment. It's low cost, high impact. But the thing that's really amazing is they've grown it. So Governor Lee, for example, he's very focused on the criminal justice population and has done amazing work to intervene both in sentencing practice as well as intervention prevention practice, as well as follow up with individuals. So he helped us expand the Creating Homes Initiative for the criminal justice area. And I just got the report today about who we're going to recommend to fund. And I haven't been able to approve the final funding, so I'm not going to get into that.
Okay, that's all right.
But again, it's based on this premise that if you take dollars, you can leverage other dollars and create more options. So that's one practice. The Tennessee Recovery Navigators, this is related to addiction. We have taken individuals who are in recovery, had local programs, providers hire them, and when someone's overdosing in the emergency department, they're going into the emergency department and talking to that individual and basically saying, you know, I've been through the same thing. Would you like to have a better path? Would you like to be connected to treatment? Because treatment works.
So in that way, it's not just some official, you know, government worker or whatever. You've got someone coming in and immediately connecting, trying to connect emotionally, saying, I've been there and you can get, you know, you can do this.
Yeah, and what's really great, Rhori, is that we've seen almost a 90% connection to treatment. So in that moment, that person many times is at their lowest point. So you've got that plus this individual going, I've been where you 2 years of recovery, let me get you into treatment. And I can't say enough positive about that innovative practice that we've been asked to talk about. Another innovative practice, Project Rural Recovery. You know, so many years we talked about how do we get people transported for treatment. I mean, we have talked about that year after year after year. Under Governor Lee, we proposed a plan to the federal government and to him, which would buy vans for rural communities and actually just go into that community's town and be available to do assessment, intervention, and connect people up. That is working like gangbusters across the county.
That ties into the whole access. Rural areas, you know, I know there's a push for broadband internet, which is huge because then they can figure out what's available. They can go online and figure out what services, but the same thing, seeing event, because there's so much space between, you know, the nearest facility is maybe, you know, it's not like right here in Nashville where it's so close.
Absolutely. And then things like our recovery courts, not only have we done national best practice around having recovery courts where judges work with individuals and you wrap around treatment with that person, But for individuals that need longer intervention, we have residential recovery courts. And so Governor Lee, the legislature, have funded the ability to enhance and expand those. We just opened the women's residential recovery court here in Nashville a few weeks back. Judge Dalton is the presiding judge, and we couldn't be more happy about that program and the ability for women to have a longer-term place for treatment. We have school-based behavioral health liaisons, where people that are in a county have an individual that's got background in counseling, intervention. That person's available for the teachers, for the students, for the parents, to help access them to treatment. I mean, I can go, it's amazing how many evidence-based
There's a
practices.
lot. I mean, it's a multi-pronged thing. It really reaches out. I'm glad you brought up schools. It's like you're reading my mind, because I want to get now to the pandemic, because, 2 years ago, right now, I mean, it was this, I remember, because it was spring break and I was supposed to take my son to California to look at some colleges and the whole thing the week before, the campuses got shut down, the tours canceled, so we had to cancel the whole trip. What do you think, we've learned about the pandemic's impact, which we know is there? There's been a lot of coverage on people's overall mental health, the stress, the anxiety, and especially in our schools, there's been not only the learning loss, but just added stress and anxiety. Talk about what your department has learned and how you take all this information from these 2 years and go forward.
Well, I'll tell you one thing that we talked about is if we weren't optimistic and did not believe in the promise of recovery, these last 2 years have hit all of us hard. We've been moving forward and making such great gains related to mental health, substance use, and then the pandemic hit.
Right.
If you look at the data, prior to the pandemic, typically 20% of individuals reported some sort of mental health, anxiety, depression that happened within that year's period. After the pandemic, within the first year and second year, we were seeing numbers as high as 40 to 50% of Tennesseans, not just national numbers, but Tennesseans through surveys that were done that were struggling with anxiety, struggling with depression. And then you couple that with the increase in addiction. I can't tell you the number of people that have emailed me or called me around issues with alcohol. I mean, a lot of times we forget that alcohol is something that can be, and that we've seen an increase in. Fentanyl-laced pills. If there's one thing, I don't know, anybody's listening that's thinking about purchasing a pill off the street, this is not the time or place to do that.
It's almost, I think I heard something today on the radio, some arrests for people selling fentanyl-laced heroin, I think it was, or maybe pills. It's extremely dangerous, and this is a huge problem.
Yeah, it's deadly. We've seen double the overdose rate, and it's not that people are overdosing on prescription pills in the way that they were prior. It's really people buying pills off the street or from a friend and thinking that it's safe. It's not. If there's anything I could say to young people and adults, please, if you're about to take a pill that you don't know where it came from, you bought it off the street, go to the emergency department and just say, or call our 1-800 number. We would rather you call the red line, actually, go to the red line, just seek help to get into treatment, so that you don't lose your life. Right. Your life is precious.
So when we talk about the pandemic, I'm trying to look at the silver lining here. We know all these issues have increased, people reporting issues with their emotional and mental health. On the one hand, that's a stressor for your department, for anyone dealing in that area to provide, to kind of answer the call and respond and try to provide assistance. On the plus side, it is definitely, again, bringing the issue to the forefront. It's getting people talking about it, right? So we have to take advantage of that somehow in a positive way.
Yeah, and I'll tell you one of the things that happened in a very positive way. Our laws and regulations allowed us to do telehealth. So even during the pandemic, when we were struggling with can we get to people and get them the help they need, we were able to have providers actually operate through telehealth, even phone calls. Even during the pandemic, it's like if we could talk to you just on the phone,
right,
and make sure you have what you need, that was better than no visit whatsoever. And so that is one silver lining. You were talking about silver lining. One silver lining outcome from the pandemic is being able to use other modes to have intervention to really access people.
So now 2 years later, and knock on wood, we're hoping that we're at the tail end of the pandemic, and I know there are reports of increased cases with another variant coming around, but so far it looks okay. I'm not going to say anything. But so now you go before Governor Lee to present your budget, and I know that he has made it a priority. How has it changed your department's focus, if anything? What is Governor Lee's kind of his priorities for your budget and your department?
Thanks for asking that. Well, Rhori, one of the things that we really focused on this year is the fact that we have a tremendous workforce shortage across this state. This is not just in Tennessee. This is nationally, and you can see that not just in the hospital, healthcare, mental health, substance use area. It's across hospitality. It's across manufacturing.
I can tell you it's affecting us too. If you know anyone out there who wants to be a producer in news and has some experience, we're hiring. But go ahead.
And I believe you. I mean, it's really, really hard. And so one of the things that Governor Lee did is he asked us to do research. We worked with TennCare. Our team put together a report that looked at how we fared with salaries compared to other southern states and other industries within our state. And I was so grateful that he included the $18 million so that we could give an increase to our providers so that they could increase salaries. What's great about that, Rhori, is not just our department, but TennCare also asked for funding. So sort of mirror each other as we are both funders for those that provide services. So he's very committed to that. Second area that he's very committed to, we have a large gap for uninsured substance use treatment services. We're doing so good on the mental health side with the safety net, but we had prior to the pandemic about a 32,000 person gap. So if you're coming to our services and you're uninsured, about 32,000 people we don't have the funding for across the state. Right. So he allowed us and has moved forward with the $6 million request to expand that continuum of care for substance addiction treatment. In addition to that, we have what's called ARP. ARP is addiction recovery programs, which are wraparound services. And there's been an addition made to that. Another thing that he's extremely supportive of is employment efforts. So now is the best time. If you're an individual that's struggling with mental health and you have been on disability, now's the time to want to get a job and to know that we've got support to help you. So he has allocated funding, and we're hoping the legislature will approve it, for us to work with our sister agency, DHS, to draw down federal funds to do what's called the Creating Jobs Initiative. These are employment efforts to help individuals get into employment that have traditionally felt unsure about that. And now we're really going to be able to make a difference with those individuals. The Morgan County Residential Recovery Court, Judge Norman, who is from Nashville, sort of the father of drug courts, he also oversees the Morgan County court. He works with that, and that would allow us to expand the number of beds for that. Those are just some
a lot.
highlights.
And I should point out, again, we're talking about, and then we got to go to a break. We're talking, Commissioner, about investments now, and I know we are a fiscally conservative state. We have a constitutional amendment saying we must balance the budget, so that is important. Taxpayers want to keep, everyone wants to keep everything as low as possible to make it livable. On the other hand, the need is growing, and if you take someone like that, someone who can get some help, who maybe is right now relying on government programs for everything, get them some help, get them healthier, help them get a good job where now they're not as reliant on the state, and now they're out there providing for themselves and paying taxes. So it all kind of flips, and the outcome in theory is very, very positive. That's what we're all hoping for.
Yeah, it's a win-win-win all the way around. It really is.
All right, with that positive note, we'll take a break, come back with our final segment with the Commissioner right after this.
Thank you.